The purpose of today's event is to present the findings of the freshly published report, UK Migration Policy and the Welsh NHS in Social Care Workforce. The link is available at the top of the chat bar. As well as discussing the report's main findings, I'm hoping this event will spark a discussion about what the system can do to support its workforce in the future. You can also join in the conversation on Twitter by using the hashtags that you see on the slides. There are many workforce challenges facing the Welsh NHS and social care sector. In order to address these, the sector is reliant to some degree on recruiting talented staff from around the world to supplement the domestic labour supply and keep essential services running. The UK immigration policies that come as a result of ending free movement and exiting the EU mean that EU nationals will face a much different immigration system than ever before. Will a points-based immigration system enable or hinder international recruitment into the Welsh NHS? What are the implications for social care? And how will these interact with the post-COVID labour market? Today, we will look into just that. As part of the EU Transition Support Fund grant received from the Welsh Government, the Welsh NHS Confederation commissioned the Wales Centre for Public Policy to analyse the likely effects of changes to UK migration policy on the health and social care workforce. They looked at which staff groups might be the most affected and the potential implications for long-term workforce strategy for health and social care, including future recruitment and retention. In today's event, we will hear the main findings from the researchers leading this paper, and then I will open up the floor to questions and discussion from the audience. I now would like to introduce the members of our panel. Dr. Craig Johnson is a research associate with the Wales Centre for Public Policy. He joined the centre in 2017 after completing a PhD in politics at Newcastle University. His areas of research for the centre focus on the Welsh economy, Brexit, and the coronavirus pandemic. Jonathan Portes is a professor of economics and public policy at King's College London. His research covers both immigration and Brexit, and he has previously undertaken research for the Welsh Government on the impact of Brexit on EU citizens in Wales and post-Brexit migration to Wales. And finally, Dr. Elsa Uman is an honorary research fellow at the University of Warwick. She's also a visiting fellow at Goldsmiths at University of London and has extensive research experience in both applied and academic research on youth mobility, EU-India mobility arrangements, and the international labour markets. Before we begin, I would like to thank the members of the steering group for helping to guide this research. So a big thank you to Angie Oliver with Health Education and Improvement Wales, Julie Castley with Cardiff and Vale University Health Board, Gareth Hardiker with NHS Wales Shared Service Partnership, Jonathan Morgan with ADSS Cymru, and Bethan Bateman with Welsh Government. Please feel free to ask questions throughout the webinar in the chat function, as well as general conclusions or thoughts you may have. We are encouraging active engagement, so you can also raise your hand and we will get to as many questions as we can by the end of the session. I know some members of the steering group are also on today's event, so if you do feel like you want to contribute, please do so as you wish. Feel free for everyone to chip into the discussion, and we can ask any questions to both the people on the panel as well as others in the audience. Now I would like to introduce our first speaker, Dr. Craig Johnson. Craig, take it away.
Thank you very much. Okay, I'm just going to try and share my screen as well, if that's possible. Okay, so thank you everyone. My name is Craig Johnson. I'm a research associate with the Wales Centre for Public Policy. To just talk you through how the session is going to go, so I'm just going to introduce the policy and research context for the research that we've done, and I'll just say a little bit about where we got hold of the data and what we've done with that in connection to the Welsh NHS. I'll then hand over to Jonathan to talk about the potential effects of the new system and the implications for the NHS. I'll then come back at the end to talk about the implications for social care, and then just some concluding thoughts as well. So just for some context, so as a consequence of the UK leaving the European Union, free movement rules concerning EU migrants will end. So as a member of the European Union, there were very few restrictions on EU nationals moving to the UK for work. In contrast, non-EU citizens must apply to work in the UK, generally through a Tier 2 visa. Eligibility for this working visa depends on the qualifications required, whether the job is listed as a shortage occupation, and the salary that's involved. Now, in November 2018, the UK government proposed to replace this system with one that was deemed to be more skills-based and one that treated potential migrants from the European Union and outside the European Union on the same basis. To do this, they proposed a modified and simplified version of the current Tier 2 system. It's worth noting this wouldn't apply to Irish nationals who will continue to have the right to live and work in the UK. A key requirement in the new system would be a job paying £30,000 a year, as well as a minimum qualification level roughly equivalent to an A level. Now, we published an assessment of the immigration white paper proposals at the time, which were authored by Jonathan, which found that the proposals could substantially reduce slow-paid EU migration, but also reduce middle and higher-paid EU migration as well. It also found that migration from outside the European Union might increase. However, the changes would not only affect workers often labelled, rightly or wrongly, as low-skilled, those with recognised skills in specific and important sectors, including social care, would also likely be badly affected. Now, these proposals from the UK government were widely criticised across the health and social care sectors, both in Wales and across the UK, both in those organisations and in research teams as well. In particular, the £30,000 salary threshold, which couldn't be prorated to account for part-time employment, was generally seen as too high and likely to result in significant pressures across a number of sectors, including health and social care. Following that, the UK government subsequently reconsidered aspects of the proposals based on a review of the salary threshold by the Migration Advisory Committee, and they published further and more detailed proposals earlier this year. So just to talk through some of those, so the basic principles of the new system remain the same as those that were previously proposed by the UK government in 2018, but there are a number of key modifications. So firstly, the salary threshold for the new skilled worker visa, which will replace the Tier 2 visa, has been reduced to £25,600 or the going rate for the job, whichever is deemed higher. This means that a significantly greater proportion of jobs are potentially open to non-UK applicants, but quite importantly, it will still not be prorated to account for part-time employment. A new health and care visa has been introduced, which means that for certain occupations, the salary threshold will be set at the appropriate NHS pay scale. In other words, for those roles that are on that list, the NHS can essentially hire non-UK nationals to those roles. Now, this covers many roles in the NHS. It doesn't cover all, but it does cover many, and we've published the current provisional list in the report. Fewer social care roles will be included as part of the new system, so the new rules should allow international workers in some roles, so that would include nurses, occupational therapists and social workers, but the full details are still to be clarified and understandably will cause more concern in the social care sector. There are also various visa costs and charges for the different visas, and we detail these in full in the report, and Jonathan will speak to one or two examples later on. So ultimately, the proposal suggests that there are three groups of people that we should consider for this research and its implications. So first of all, there are those that fall within the health and care visa. This should include all medical, dental and nursing professions. Secondly, there are those that qualify for the skilled worker visa, which essentially corresponds to band 5 or above on the NHS Wales pay scale. And then finally, importantly, there are those that would fall into neither of those categories. And where there are EU nationals that currently occupy those roles or might have occupied them in the future, that's where we have areas of concern. So we managed to get hold of data from Health Education and Improvement Wales, and many thanks to HIW and to the Confed for making that data available. That data covers existing Welsh NHS workforce from local health boards and Wales-wide organisations such as Public Health Wales and WAST and so on. Social care workforce data isn't readily available, and we don't cover that data in the report, partly just because of the disparate nature of employment in the sector, the many employees and organisations and commissioning that's involved. That data is not readily available at the moment. It also doesn't cover primary care staff. We understand that data is being collated and made available much more easily, but it wasn't available for this piece of work. So we readily accept that it's not a perfect picture, but firstly, it is as full a picture as we can get, and secondly, we do think it gives a reasonable sense of the workforce and allows us to make some interpretations and implications. So with that in mind, I'll hand over to Jonathan.
Okay, thank you very much, Craig. I'm now going to present the work which Elsa Uman and I did using the NHS data that we were provided with, and draw out some of the implications given what Craig has said about the new system, which I'll go into a bit more detail about. So first of all, I think it was indeed very useful to get this data, and I think it does not cover social care or primary care, but the coverage of the NHS, the Welsh NHS itself, is actually quite good. The data is relatively clean and reliable, and the number of missing records or records where it's not clear what category people fall into has fallen over time. So the data is actually, I think, now quite reliable. We did have to make some assumptions in assigning people to particular groups, which could have the effect of overall biasing it a little bit in one direction or the other. I won't go into that in detail, although I can explain if anyone asks. But we think that we've done the best we can with the data we have. So what does it show? Well, interestingly, it shows a picture of actually slight decreasing dependence on non-UK nationals over time, and in particular decreasing dependence on EU nationals over time. And the data that we have also on starters and leavers also confirms that, that particularly since Brexit, some EU nationals have already, for whatever reason, left the Welsh NHS, and to a limited extent at least been replaced by non-EU nationals. Now I think there are sort of, you can read that in different ways in terms of what it means going forward, but I think that in itself has some interesting implications, which I'll mention later. Where is the Welsh NHS most dependent on non-UK nationals? Well, that's very clear, I think, from this data. Overall, it is very much medical and dental staff that come from outside, with so compared to only about overall, and this is an interesting difference with the rest of the UK, or at least with England. So for England, 14% of NHS staff are non-UK. For Wales, it's 8%, so considerably lower. But for medical and dental staff, actually, the dependence here, which is about a quarter, is actually not that dissimilar to England. So Wales is, different in this respect. It's particularly dependent on non-EU medical and dental staff, which again has some interesting implications. EU staff are more spread throughout the whole NHS. You can see significant proportions in additional clinical services, estates, and nursing. So Craig briefly described the new system, so I won't go through this in any detail. I think it is important, of course, and we should always note this when discussing this topic, that EU nationals who are here at the moment, and indeed are here through till anybody who arrives before December the 31st of this year, has the right to stay permanently. That is, they have the right to apply for either settled status or pre-settled status, which leads to settled status. And it's obviously perhaps the most important single priority is for is to make sure that people who are currently here do indeed apply in good time, no later than June 30th. This now then is the key chart where we look at the implication of the new system. Actually, there's a slight contraction in the headline. That's really visa eligibility over all staff. So we're looking at. So let me explain this chart. What it looks at is if you look in each year at the staff, which would, had the new system been in operation in that year, which of those people would in principle have qualified for either a healthcare visa or a tier 2, or not tier 2, a skilled worker visa, the equivalent of the old tier 2. And what you can see here is that and this is probably not surprising because it follows from the existence of the system, most non-EU nationals currently working in the Welsh NHS would, the vast majority, at least 5/6 of them, would have qualified for a work visa under the new system. And that's not surprising because the new system is for non-EU nationals more liberal than the existing system. Why is there anyone in this group at all? Well, the answer is, of course, you can get to this country and have the right to work as a non-EU national through other means than simply getting a skilled worker visa on your own account. You can come as a refugee, a family member, etc., etc. So it's not surprising that there are some non-EU nationals who would have not have qualified and will not qualify in the future. But I think the key thing for non-EU nationals that the vast majority of people here already would have been able to come in under the new system. That is much less obviously the case for EU nationals, where somewhat more than half of them, 2.5% of the workforce, are EU nationals who would qualify under the new system, but 2% of the workforce are EU nationals who, as far as we can tell, would not have qualified under the new system, and that's clearly the grade where the risks are the group where the potential future risks are the largest. And this looks at it similarly just for new starters, which obviously is more relevant going forward, who would have qualified for a visa and who wouldn't. And again, you can see that the vast majority of non-EU nationals, making up 6.6 of new starters, would have qualified under the new system, whereas there's still a reasonable number of new starters of EU nationals who will not qualify under the new system, although that proportion has gone down in the last few years, halved in fact, reflecting, as I said, the fact that since the Brexit vote, EU national recruitment has been significantly reduced already. So this is pre-Brexit, or pre the end of free movement, but post-Brexit referendum. We thought it would be useful to give also some an idea, because of course it's not just about whether or not you're eligible for a visa. You also have to go through the application process, and you have to, the employer, the employee, and the employee both have to pay various charges, including visa fees, the immigration health charge in some cases, and the immigration skills charge in some cases. So here we compare some of what that might mean, you get a very mixed picture here. So, for example, for an EU nurse, the introduction of the healthcare visa, which has relatively low fees, and the exemption from the two charges means that while there will be a charge in future and there isn't now, it will be relatively modest. But there's still a cost increase. By contrast, for a doctor coming from outside the EU, we see this very, very large reduction to the extremely high level of charges at present, going down, visa fees being halved or more than halved, and the exemption from the skills and health charge, meaning that those costs will fall very substantially. For an IT specialist who wouldn't qualify for the HCV, but a skilled worker, the costs remain the same roughly for a non-EU migrant, but for somebody coming within the EU to do a skilled role that's not a medical or healthcare role, then there is this very large increase in fees. And this illustrates the point that Craig made in respect to my earlier work, which is that despite some rhetoric you hear about, well, of course, we'll still get skilled workers from the EU, we're not keeping them out. It's true that such people will almost certainly be able to qualify for visas under the new system. That doesn't mean they'll want to come here if they have to face the application process and these very large fees. And I should note that there are other fees that we haven't bothered to capture on this particular slide, particularly if you have dependents, and there the administrative burden on the employer as well. So there is a significant new barrier for at least some EU workers, even if they would qualify under the new scheme. So what are the implications that we draw from this? I think, first of all, I'd say that this paints a relatively positive picture, and it paints a considerably more positive picture than that, as Craig referred to the work that I did for the Welsh Government looking at the Theresa May points-based system. Well, the Boris Johnson points-based system with the lower salary threshold combined with the new HCV means that the picture is much, much brighter than it is then. And overall, as far as we can tell, while there are going to be issues, they should be relatively manageable. Nonetheless, a small but significant number of EU nationals would be excluded. Cleaning and support staff, ambulance drivers, pharmacy technicians. These are people who don't quite make it into the to the HCV group, and certainly don't make it into the salary above the salary thresholds and so on to make it into the skilled worker visa group. So there are some issues there. So that's and then I've noted the additional costs as well on the previous side. However, the counter to this and the positive element is that if the HCV functions well, it should both be easier and cheaper to recruit non-EU staff, particularly for medical jobs. And I think the evidence of the last few years, even before the new system was introduced, shows that there has already been something of a switch from EU to non-EU nationals in the Welsh NHS, presumably because even before the end of free movement, EU nationals found this country less attractive, but some of that slack has clearly been taken up by non-EU nationals already, and it should be easier and cheaper to do that in future. And so again, I think that's a positive. I'll just conclude by saying, and moving on to Craig for the next section, which is, I think we did not have data on the social care sector, but just from looking at the occupations here, the salary and the salaries, it is absolutely clear the implications for the social care sector are significantly more adverse than they are for the NHS proper. And I think you don't need to see detailed data to know that, and that I think is where some of the bigger policy risk is likely to come. So with that, I will pass on to Craig.
Thank you, Jonathan. Okay, so hopefully you can see the slide there on social care. So there are particular difficulties relating to the immigration rule changes for social care. As Jonathan said, it's simply just more difficult for those working in social care to meet the criteria set out by the UK Home Office in relation to the salary and the qualifications necessary to be eligible for a job. Now, work by the Cavendish Coalition, which is a group of UK health and social care organisations, found that nearly 3/4 of social care occupations across the UK do not meet the qualification threshold, nor do they earn enough to meet the salary threshold. It's worth remembering some context, though, that even with the current free movement of people from the European Union for work, the social care sector already has severe staffing issues. Social care remains a low-paid sector. In Wales, average earnings in full-time terms are approximately £17,000, compared to the Welsh average across all jobs of £29,000. Fewer than half of the personal care workforce are paid the real living wage in Wales, and the prevalence of women in the workforce also means that these impacts are gendered, having a more significant impact on women who more often take on social care roles and more often work in part-time environments. In addition to this, the social care sector experiences high rates of turnover in staff, and this is more so for commission services than ones provided by local authorities directly. And recent research for the Welsh Government has shown that over half of registered social care providers in Wales reported difficulties recruiting to vacancies, with over a quarter indicating they become very difficult, so severe staffing challenges more generally as well. Finally, it's also unclear to what extent small changes in policy by the UK government would actually solve or ease the problem. So adding additional social care job types to the list of shortage occupations, it could help, but even then the low salaries and often part-time working arrangements of social care staff would still leave potential workers struggling to qualify. You could add additional visa routes for temporary or what might be deemed low-skilled workers, but again we question that term, and that could address the gap as well, but this seems unlikely to be a priority for the UK government. One final consideration is whether the coronavirus pandemic might generate a long-term shift in domestic labour supply and make it easier to hire domestic labour, might be more attractive for workers in the UK, but it's too early to tell whether this might be the case. Jonathan mentioned that the NHS could come out of this quite well, so long as the structures of support are provided and provided well. And so I just want to try and touch on some of these things about how employers and new workers can be supported within the new rules. We think that much can be learned from how the Welsh Government, health boards, Wales-wide organisations, Health Education and Improvement Wales, NHS Shared Services Partnership and local authorities have all supported EU citizens to acquire pre-settled or settled status within the UK. The scheme has been open since March 2019, and since then the Welsh Government has announced a package of support to help EU citizens who are living and working in Wales to continue to do so. That might include digital support with their applications, advice on welfare and workers' rights, immigration advice for cases that have been more complex, and local authorities have also supplied detailed information as to help and support that is available, both in general terms and for hard to reach individuals as well. There have been some issues with the application process. This has been documented in the UK media since 2019, but in broad terms it has been relatively straightforward for Welsh NHS employees, particularly as they're in quite an advantageous position relative to some others to demonstrate their employment status with NHS Wales. And conversations that we've had with bodies within the sector suggest the scheme has generally worked quite well and the system of support has been satisfactory. Another helpful indicator of potential support the system might provide is to think about the support currently given to Tier 2 visa applicants in NHS Wales. NHS Wales Shared Services Partnership is responsible for sponsoring all junior medical and dental workers and trainees requiring a Tier 2 visa, and this is delivered in conjunction with HRW, and again it seems to suggest this support works quite well at the moment. So bringing these sort of examples together with how the new system might look in future, as an already approved sponsoring body and organisation, and with a good system already in place for international recruitment, we think the Welsh NHS should be well placed to support new workers who meet the criteria either for the skilled worker visa or for the health and care visa. The processes themselves shouldn't be radically different from existing procedures connecting to Tier 2 workers or to settled status schemes, and particular attention will need to be paid at certain sort of key pinch points, particularly January 2021, but we think generally the organisation should be amongst the better placed within Wales and the UK to support new recruits from 2021 onwards. And so just to bring this to a close, just with some concluding remarks, and then very much welcome questions, but also just sort of general comments and observations from you all. The introduction of the health and care visa, and in particular its wide-ranging coverage across medical, professional and technical services within the NHS, suggests that the specific impacts on NHS recruitment in Wales might be quite limited. Most roles within the Welsh NHS will qualify for either a health and care visa or a skilled worker visa, and the overall impacts should be small. There will still be some jobs that will slip through the net though with the new criteria, and an existing system of support for recruits will need to adapt to continue providing important and highly valued people to join the workforce. We think that the implications for social care will be more severe. Fewer roles will qualify for the health and care visa or the skilled worker visa, and the greater turnover of staff presents particular challenges. Given both the importance of social care provision for the NHS and the desire for an integrated health and social care system in Wales, these particular challenges do present a potential vulnerability for the whole system in the future. And we did this work for the NHS Confit, and we think if they or other organisations might wish to change the system to favour future recruitment and retention, the priority is likely to be expanding the eligibility of occupations that are important within the social care sector for the health and care visa, or failing that, increasing the roles that are on the shortage occupational list. A more general reduction in the salary threshold would also be helpful, both for the NHS and social care, but each of these might not solve the particular problem, but they might soften the effects. And with that, I'll hand you back to Victoria.
Great, thank you so much, everyone, for the excellent examination of the report. So now I'd like to bring out some question and answers. So we had a couple in the chat. We'll go to the first one from Alison, and her question was around, is there any data on allied health professionals or healthcare scientists? Elsa, would you like to speak to that point? You're on mute, Elsa.
Victoria, could you say that question again?
Yeah, so it was, is there any data on allied health professionals or healthcare scientists that we looked at in the report?
Okay, so we do know that biological scientists, biochemists, and any sort of specific skill, like highly skilled professionals, will qualify either exclusively on the health and care visa or on the PhD route. So although we didn't have specific data on it, our data was mostly across different bands in a sense how the Welsh NHS data was calculated, but it's sure that they will qualify. Those highly skilled professionals will qualify for a visa.
Thank you for that, Alison. I hope that answered your question. If not, feel free to contribute still in the chat. We have a second question from Kelly, and she asked, how do we know the date someone has entered the country when we're going through the recruitment process? And can this be evidenced? When should we start checking settled status? John, I noticed that you entered a little bit into the comment section. Would you like to elaborate on that a bit?
I did answer it, but I think Bethan has provided a fuller and more useful, more detailed and more accurate answer in the comments, which is that the current system of right to work checks by employers will not change until the 30th of June 2021. I mean, I think this is not Bethan's fault because she just posted what the Home Office has said, but there is a pretty obvious, you know, this is a contradiction which has been around for a while and which Home Office are going to have to resolve. But the Home Office says that you can still regard a passport, an EU passport or EEA passport as demonstration of the right to work until the 30th of June. But in principle, they don't have the right to work if they've arrived after the 1st of January. So they would be working illegally, but it wouldn't be your fault. But how this will be enforced and in what, you know, it seems to me rather odd, because it's all very well to say you're not criminally liable, which but you don't want to hire somebody who then you have to sack because you discover that they're being working illegally or they are hauled off by the Home Office. So this is a very unsatisfactory situation in my view. I mean, I think I'm not an immigration lawyer, but my advice would be that, you know, while you can accept an EU passport as right to work and you are not legally entitled to ask for anything else, you should strongly tell any new EU nationals being employed that, you know, what the position is and that they really should ensure that they do have settled status. As I say, you can't require them to produce it, and it would be discriminatory, I think, if you force them to produce it as a condition of employment, but you should strongly advise them without inquiring as to their status that they really do need to be sure that by June 31st they have got settled status one way or the other.
Exactly, I think that's a really good point, and thank you, Bethan, for having those extra details as well. And I think from what we've gathered as well, encouraging staff to sign up for the Settled Status Scheme has been such a key area across the membership of the Confederation. As you say, it's to ensure that people are filling it out and are applying to it. But exactly, it's those bits that you obviously, you can't ask for those bits of information because of immigration law, but it is that area where, as employers, you're obviously concerned about. And I'd like to reiterate that obviously Newfields Law and other organisations across Wales, are doing a lot of different services to help support the sector and help support EU residents apply to the sector. So, and I think that's really key area, and especially when we had the COVID-19 outbreak that shut down a lot of essential services, yet that deadline is obviously still maintaining us to the end of July next year. So I think that's something to really now keep on our radar and make sure that people working in the health and care sector are supported to still apply for settled status. I'd like to bring in one question that we had on registration, and that's, are we confident that we really know the workforce numbers that we need, as well as the skills and roles across health and social care? So does anyone from the panel want to kick us off in that discussion?
I think that's probably more for Craig.
I think, well, firstly, could you repeat the question, Victoria, just to try and get it exactly right, because it covers a few things.
So are we confident we really know the workforce numbers that we need, as well as the skills and roles across health and social care?
So I think firstly, I mean, are we confident? No, not with any great degree of accuracy. I think we know we have a broad sense of trends. You know, do we have a broad sense in terms of an ageing population and what we might therefore need as a response from not just from health, but then also from social care. We know that will be more pressing. We know the increasing sort of nature of the budget, both within Wales and across the UK, for the NHS and for social care. We know the desire to bring together health and social care, and we know that one is going to affect the other. So we don't have full trends. We obviously need to see how the pandemic is going to change things as well. But do we have a broad sense of, are we going to continually need more skilled workers in both of these sectors? We know the answer to that is yes. We know the broad trends over the last 5-10 years, as we've seen from the NHS data, and certainly since 2016, has been to focus more so on non-EU recruitment, and we know that should continue to be a potential sort of avenue. So we've got rough senses. Do we have exact predictions and accuracy? We don't.
Thank you for that, Craig. Exactly, I think, and especially when you take COVID into account, it's changed so much of every bit of the sector and kind of obviously across everything as a whole. And especially we know place in positions like rehab, that will actually be a big area of focus as well. So whilst we do have a very good idea of what's needed, as you say, the types of roles that was an issue before, will probably still continue and will still be an area of concern. The new things that will happen in a post-COVID environment, that will be one to watch, and we really need to obviously make sure that we're supporting our members and that we're supporting the workforce and making sure that it's as strong and stable as it can be. Does anyone else from the panel want to jump in? That's fine. If not, we will go on to the second question, and I believe it's from Alison again. And she says that we know the new points-based system comes into effect on the 1st of January 2021, but do we know when we'll be able to apply for sponsorship under the new system? Current Home Office guidance is very vague with no set date, but the deadline is looming and processes and systems will need to be updated in readiness. Would anyone like to jump in on this?
I mean, I'd merely say that I can't answer the question, but I would merely say absolutely. It has been, I've been saying this for some months, that the biggest risk to employers and individuals and services of this new system is not the policy intent of the system, which in my view is as good as we could have reasonably expected, and a lot better, as I said, than what we were looking at 2 years ago. But the risk that it simply won't be up and running properly on January the 1st. And I think, Home Office are aware of this risk and working, but they there's a lot to do and not very much time to do it. And I think it is important for big employers like the NHS to impress on the Home Office that it is not just a question of getting the policy right, the systems have to be right, and that this will be very, very embarrassing to the Home Office, to ministers, and to the UK as a whole, frankly, if we haven't got a functional immigration system on January the 1st. And I think there is still a serious risk there. I think, to be fair, what I've heard, at least at third hand, is that they are more confident than they were a couple of months ago that they can deliver at least something by January the 1st. But time is pressing.
Exactly, and I think that's a very good way to put it. Time is indeed pressing. From where we've been able to influence the situation, we've also the NHS Confederation and the Welsh NHS Confederation are members of the Cabinet's Coalition. So that's a group of health and social care organisations that come together to go for specific workforce post-Brexit issues. So from my work in there, I do hope I believe the Home Office intends to make something available October time, but obviously since they are quite vague in their nature, the deadline at the minute, we will see, but I do hope that it will be in the autumn and it will be in August. Elsa, you want to come in? Oh, you're on mute.
No, I just wanted to add to the point that I think on 1st Jan 2021, what we face would be not in terms of what policy is already provided for, but actually whether systems are there in place. And I think that sort of awareness, for example, what kind of right to work proof can a person give if they are a EU national who is, either applied for a settled status or so I think that's the key thing. From the governance point of view, I think they have released opened the health and care visa, which can be applied for 3 months before starting a job. But in a sense, if a person is transitioning to the EU settled status, can they just show their current permit or to qualify for a right to work on Jan 1st? I mean, these are the kind of grey areas that need to be clear, and I think that's what isn't clear. And also in terms of sponsor management system, like big employers like NHS, what are the kind of steps they need to be taking in terms of with licenses if they have more EU nationals and that sort of questions.
Exactly, and I think as we kind of we're discussing here, whatever system will be in place in the 1st of January will be the basic system that is needed to be in place when free movement ends. And we're hoping that through this report and through our work with the Home Office and the various forums that we're on, that we're able to influence how they refine the tradable points system and what type of other things do you need to look for in a system. Will they consider years of experience? Will they consider added public value? And those different types of topical questions. And I think there also is where hopefully we will be able to really stress the importance of social care and figure out a way to embed social care into the structure of that tradable point system. Moving on, it's a bit of a discussion as well in the chat bar. Was there any success in arguing for a Wales specific shortage occupation list? And Bethan has come back to say that it's due at the end of the week from the Migration Advisory Committee. So I think that's a very interesting point to argue. And we've kind of pointed this out in the beginning as well when we were discussing about how the system is outlined, is that the Migration Advisory Committee will be coming out hopefully with a Wales-specific shortage occupation list. Their deadline is the end of September, so they do only have about 3 days left to be able to do it. But obviously that will be based on current skills and salary thresholds. So does anyone on the panel want to jump in and add to that question?
I mean, as we were chatting before, it's slightly difficult to tell since the MAC is now under new management, so they may take a different direction. But if they were to adopt the approach that they have previously, then I think it's unlikely that there will be much, if anything, in the way of a Wales-specific shortage occupation list. And certainly in social care, I think it would be quite difficult. You know, the problems that Wales faces are by no means unique. They are, and this is something that I observed, I think, in my earlier report for the Welsh government, looking at different systems. But I think that for that, the conclusion held the same, that it's, in demographics and labour markets, Wales is a lot more like a number of English regions than it is different. The big differences between are really between London and the southeast and much of the rest of England and Wales on the one hand, rather than between Wales and England on the other. And I think that therefore, if something is going to be done, particularly on social care, it will apply to England as well as to Wales.
Yeah, exactly. I think a lot of people are waiting on bated breath on that report to see exactly what it finds, if there will be a Wales-specific shortage occupation list, and if there is, will it be any different to, as you say, an England or a Scottish one? And we'll see how that report goes too. And I am hoping that we'll be able to, at the end of the week, make some comments about that if it's released on time from the Migration Advisory Committee. We have another question in the chat about third sector workforce. So it says the third sector workforce delivers obviously a range of health and social care support, commissioned and non-commissioned, but is there any workforce mapping data available for the third sector across Wales?
I can give a somewhat kind of unhelpful answer to that, I think. So my sense is that we don't have fantastic mapping data, but we've got a rough sense from the Wales Council for Voluntary Actions, the WCVA. I think their data hub for this accounts for, I think it's over 500 organisations that they account for. I think they find something like 10% of employment across Wales is in the third sector, and they find that the majority of that is in health and social care, and you can imagine it's those sorts of roles that the NHS wouldn't otherwise provide that are the ones that are being provided. So that's the broadest sense we have. We know that data is incomplete, we know it's imperfect, we know it's going to be inputted in different ways from different organisations, so to actually kind of use it in any research way is difficult, but it does underline its importance at the very least.
Great, thank you for that. We have about 10 minutes left in today's event, so if there's any other questions, please feel free to add them to the chat as we go. I'll take one more question that we actually got on registration, and this asks, are there any devolved powers which can be used by Welsh Government to maintain their current social workforce following the challenges as we leave the EU?
Well, I mean, as I said, I think the key issue here is encouraging directly or indirectly EU nationals who are currently here to take up to apply for settled status and make sure that they do have settled status, if at all possible, before January the 1st, so that they have that reassurance that they have the right to remain in the country, the right to live here, and so on. I'm sure there's other sort of forms of soft support. Of course, Wales doesn't have any devolved powers over immigration policy per se, so there's not very much that can be done on that side. It's more a question of what sort of support can be provided to the workforce, and in particular to EU nationals who our data show clearly are not very happy about Brexit, because quite a lot of them have gone home.
Fabulous, thank you. If anyone else wants to jump on, then that's great too. If Craig?
Yeah, I might just say it's just worth remembering, as Jonathan sort of said there, the distinction between what is devolved and what's not. So where there's no devolution, so in relation to immigration, it is pressure and it's lobbying, not just from Welsh Government, but also from organisations like the Confeds who've represented their members throughout since Brexit referendum on these issues. There are little things that can be done. So I say this isn't just a case of sort of workers and the skill threshold and the qualification and salary threshold. It's the support you can provide to people throughout the process, and we know that the Welsh NHS and Welsh Government has done that since 2016. That could continue. There might just be some financial support that could be provided in certain sectors. I mean, we've seen that a little bit with Wales and social care, just in the coronavirus pandemic, for instance, and the bonus provided to workers. So there are, again, they're quite small tools available, but they can be important and just provide additional little levels of support.
Exactly, I think that's a great way to put it. And I think it does go towards the argument that in Wales we've been having for a very long time about a more integrated health and social care system, that it is not the NHS and then social care. It is one sector and it is one integrated area. And we are really working towards a more integrated system. So I think that will come up throughout the coming months and years to follow. Dan, I see that you also have your hand up. Do you want to come in?
I just wanted to add something that hasn't, I guess a couple of points that haven't come up so far. One, I think, is that, to my mind, I think what we're seeing through this work is that the kind of the challenges that the new migration system would place on social care in particular are in a way a symptom of deeper and more kind of issues that have a longer history within the social care sector around funding and around the structure of the care sector and the fragmentation of this care sector. And so in some senses, although this work kind of flags the fact that there'll be particular issues within the social care sector, those are not exclusively and probably not predominantly a function of the immigration system. They're actually a function of something else that's going on within the social care sector. So just to say that. And then just to note as well, one of the other things that that comes through from our work is that one of the challenges within social care sector is around high turnover of staff, and particularly in commissioned services. I haven't seen work that articulates why that is. I think Social Care Wales might have looked at it, and other researchers in Wales might have looked at it, but I don't know off the top of my head why that is. It could be about kind of annual funding cycles and what that then means for commissioned services and for staff within those commissioned services. But the suggestion that for commissioned services, something like there's a kind of a 20% turnover rate in staff that's kind of points at kind of bigger issues for social care sector. So that's why I wanted to bring up those two points.
Great, thank you, Dan. And Dan is also with the Wales Centre for Public Policy. We had one last question in the chat, which Nesta has already spoken to some degree. So that asks, are there any areas or health boards which are particularly vulnerable to changes in recruitment? And so we pointed out that the research didn't quite look at a health board level data. We looked at an all Wales picture. What we did find out was that there is more reliance on EU nationals in South Wales. So that's Cardiff Vale, Cwntaf Morgannwg, and Swansea Bay. So that's what we've found so far. And I think it also goes to connecting the importance of these immigration systems and the changing ways from a UK level to the Wales level policy, and that will be done through things like a Healthier Wales and the joint workforce strategy when that is out. And I think that goes to the overall attractiveness of the sector and across the health boards, and how each health board might have its own different needs and different challenges in the recruitment sector. So I'll very quickly go to the panel to see if they have anything else they would like to say on that before closing remarks.
I can just say briefly, I mean, I'd echo what both you and Nesta have said about the geographical spreads. I mean, we've highlighted one or two examples of particular roles. I mean, for instance, ambulance drivers, and so you can see the sort of knock-on effects organisations potentially, but we didn't look at it in detail just because of that level of data that was available, but a concentration in South Wales was the broad message, but not enough to necessarily suggest that I point to particular problems in particular places.
Yes, I agree with that.
Great, thank you all. And we are sadly out of time for today's session, so I will bring things to a close. And I think we've had a very interesting discussion about how these immigration policies will impact the workforce of both the NHS and social care in Wales. So for us, developing an integrated health and social care system focused on partnership and collaborative working across all sectors is one of the biggest challenges facing the Welsh health and social care system. In recent years, there have been significant pressures around capacity and demand for care services, and the coronavirus pandemic has exacerbated this problem. Meeting the various challenges of having a strong and stable workforce is also no small feat. From high levels of vacancies in many areas, such as nursing, to a reduced amount of skilled domestic staff, to the overall attractiveness of the sector, despite new immigration rules put in place from the UK exiting the EU, the Welsh NHS and social care sector will always be reliant to a degree on international workforce to maintain its essential services. I would like to reiterate our call that the Welsh NHS Confederation wants a future immigration policy that retains and attracts talented individuals worldwide to work in our health and social care services. While the NHS will be relatively protected from the end of free movement by the health and care visa, we must not forget that groups will slip through the cracks. While this will represent a smaller proportion of our workforce, it does represent a lot of people that are currently providing essential services, especially throughout the COVID-19 pandemic. This suggests that a small but not insignificant impact on future recruitment is likely. In the future, we need to take this into consideration with future workforce planning for these vulnerable roles. Compared with the existing system, it will be easier and for the health and care visa cheaper for non-EU nationals, but considerably harder and more expensive for EU nationals to come and work in the health and social care sector. However, as it is clear, the greatest impact will be felt with our social care colleagues. They are also reliant on international migrants, and particularly those EU nationals who contribute to the delivery of essential services and culture of the sector. The rhetoric that roles in social care are low skilled, which has been refuted by many in the favorable recruitment for healthcare over social care roles in the immigration policies, does not contribute to a positive dialogue of attracting talented people to the sector. I hope the take-home message from today is this: the NHS is not okay unless social care is okay. The impacts felt in the social care system will have knock-on impacts to the NHS for workforce planning and service delivery. We, as the Welsh NHS Confederation, will continue to work with groups such as the Cavendish Coalition and the Home Office to continually pass on our members' views and advocate for changes to the immigration system that will better support the social care sector. We will also work with the NHS and social care sector as a whole to combine the vision of a healthier Wales and the long-term joint workforce strategy to continue to develop a diverse workforce, both domestically and abroad. I do hope that everyone enjoyed today's event. The slides will be sent to all attendees in a few days' time, and a recording will be available on our YouTube channel to watch later. Thank you to all of our speakers as well, who helped to contribute to a great discussion. Keep an eye out this week as we will continue to promote the report and its findings, and please share far and wide. On that note, thank you all for joining, and I'll see you all next time.